Hi, I'm Dr. Mukesh Gupta from Lenest, Malad, Mumbai. Post Cesarean section instructions. What exactly needs to be done and what are the things that we should be careful after a woman undergoes a Cesarean section? This is the topic for discussion today, and we're going to discuss at length 5 different times. 1. Immediately after Cesarean section. 2. First 6 to 8 hours. 3. First 24 hours. 4. Before you go home, and lastly after you go home. We're going to discuss this topic related to what are the physical changes that you're going to have, what are the medications that you need to be careful about, what about the instructions for the relatives at this particular time, and last but not the least, a little about baby's care at this particular phases of post-cesarean section. So let's start with the first time. The moment you finish the cesarean section, you will be kept in the room, in the operation theater and the recovery area for some time, maybe an hour or two, till you feel a little better, and then you will be shifted to the room. The most important thing that we monitor at this time is your vitals, and we want to rule out if there's any bleeding, and that's the reason we keep you under observation. What are the physical things that happen immediately? Sometimes you may feel a little shivering, and you may feel a little rigors, you may feel numbness in your legs, you will be feeling inability to move your legs. There'll be a couple of tubes around you, one coming out from your hand, which will be for your IV fluids, antibiotics. Remember, your painkiller also goes from here, so it's very important. And also there'll be a urinary catheter, which is to drain your bladder, because you can't get up and go to the toilet, so it has to come out and it has to be collected. And this is what will be there. You will be wheeled on a trolley or on a stretcher to your room when you will be shifted to the room. Your baby at that time, immediately after delivery, is definitely handed to you. And remember, the sooner you breastfeed the baby, the better it is. Right in the operation theater, the baby will be given to you for breastfeeding. Don't miss out on this opportunity. That is the shortest interval between the delivery to the baby's feeding is the best for the baby. It also works well for initiation of labor and also helps in reducing the bleeding in the first few hours. Once you're wheeled out to the room, there'll be a lot of excitement. All the relatives will be around you. So there'll be some quick instructions for the relatives that I would like to give. Remember, all the relatives are extremely excited and extremely happy about the situation, but then they have to remember that the patient requires rest at this time. So you need to give her opportunity to rest. She is really not in the big mood for celebration. She's more wanting to take rest for some time. The effect of the anesthesia is there, so the pain will be very limited, but that vomiting and retching and discomfort because of the medications that are given during the operation and before that are all going to be a little bit troublesome for her. So give her a little time. Don't be scared seeing that she's shivering or rigors, which is very known to happen because of the hormonal changes at the early phase of pregnancy. There will be some IV fluids and other things going. The sister will keep on coming and checking all these things. Please allow the staff of the hospital to do their job. Do not interfere between them. They may keep coming and checking your abdomen. So sometimes the sister or doctor may walk in and just check your abdomen and go. And you say, what's happening? Why are you keeping on coming inside and touching my tummy? It pains. Well, we know it pains, but the reason we check is we want to see whether the uterus is contracted or not, because a uterus which is not contracted leads to a lot of bleeding and trouble. That's the reason. Let them do their job. Once the first few hours are over, most important thing is that we also need the baby to be secluded at this time. We don't want the relatives and the family and other people coming and handling the baby and kissing the baby and coochie-cooing the baby, which is not fair. You have a whole life to do that. Don't let the baby get infection because of our overzealous love and affection. Okay, remember this. Moving to the next phase, that is the 6 to 8 hours, as I said, the second phase. So the first 6 to 8 hours you will be lying in the bed. There'll be a catheter draining you. There'll be IV fluids taking care of your nutrition. So there's no need to eat or drink or anything. You may feel a little thirsty, so you may be given a few sips or ice or something like that to wet your mouth. But you may not be allowed to eat anything in the first few hours. You may not be able to get out of the bed because of the anesthesia. Don't worry about it. Gradually and slowly your legs will start getting the sensations and the numbness will go away and you'll be able to move your lower part of the body very easily. Remember, the cesarean section is most often than not done under spinal anesthesia, so you may feel that numbness only on the lower part and your upper part is still active. Antibiotics or painkillers or analgesics, etc. will be given to you from the drip. You may not require a separate injection for that. We don't want to cause unnecessary pain to you. What about the food? Everybody asks only $1 million question. What about the food, doctor? first 6 to 8 hours, we don't want to give you any food because the drips are taking care of your nutritional requirement. Also, we want your intestines to rest a little because you've just been handled and you've just been operated. After that 6 to 8 hours, you may be allowed to have sips of water, liquid, soft diet and regular diet. We believe in the policy of starting the solid food reasonably early, but we also have to check whether your abdomen is soft and is not bloating, the peristalsis is coming back or not. All these factors work a lot in our decision making. Another very important thing is that by the end of 6 to 8 hours, you may be in a position to get up, turn in the bed on your own, and most of the patients within the first 12 hours are in a position to get up and walk. Remember, the first 6 to 8 hours is the time when we are looking for if there is any complication, but at the same time, do not forget the baby. This is the time when you're going to feed the baby in lying down position. The sister will help you. Don't be worried about that. The staff will help you and you will be able to feed your baby. Every few hours, you need to get the baby to you, to your breast. Even if there is no milk coming out or very little milk coming out, still this is called as non-nutritive suckling. Let the baby suckle to the breast and it will initiate the breastfeeding and increase the milk. Once the first 6 to 8 hours are over, and then you move on to the next phase, that is the first 24 hours. Remember, in the first 24 hours, by the end of first 24 hours, your catheter is going to be out, your drips may be also removed, and you may be shifted on oral medication. Your oral food also has to be started. You may be able to sit up and walk yourself. Once the catheter is out, most important thing that you need to remember is, within a few hours, you are supposed to go and pass urine on your own. If you do not pass urine, ask help from the staff. They will be able to guide you and help you to ease the pain and the trouble and help you to pass the urine. The reason is the bladder has to get back to its original function, which is one of the key steps for your body. As regarding food, as I mentioned earlier, this is the time when you're already on your solid food and you have started. You may not pass motions on the first or second day. Don't worry about that. There's nothing much in your intestine, that's why it's not coming out. Remember, you may have had taken enema before your surgery, so everything is empty anyway. So if you're not passing motions, don't worry. But you're supposed to be knowing that whether you're passing flatus or not. Passage of flatus from your bowels is a sign that the intestine is resuming the peristaltic waves and everything is falling in place. And hence the doctor may keep asking you, have you passed flatus? Have you passed flatus? And you say, what? Why are you after me? Well, it's an important sign for us to know. Well, after the first 24 hours, before you go home, there are some basic things that we will be taking care of. You will be shifted from injectable antibiotics and medications to oral painkillers or similar such medications that needs to be given. You may have to resume your iron and calcium tablets. If you are on any other medication, say for example thyroid medication, that also needs to be given along with your other oral medications. If there are any other thing, the doctor will advise you and guide you that needs to be done. You may require some blood test, especially if your blood group is negative. Your baby must have been checked for the blood group, and if the baby is positive and you're negative, you may be given an injection to prevent complications in future pregnancies. We call it injection for anti-D. Another thing that needs to be done sometimes is if there is little bleeding or excessive bleeding, we may check for your hemoglobin and other blood counts to see if everything is fine or not. And that decision will be taken about what has to be done regarding the management. If your hemoglobin is very low, the choice is between giving you a blood transfusion versus some iron drip. That decision your doctor will take. You don't have to worry about that. From 24 hours to the time of discharge, now is the time when you're actually training yourself for motherhood. You need to learn how to handle the baby on your own. You need to be able to handle the baby yourself. You need to pick up the baby yourself, wrap the baby, change the diapers, feed the baby. Use this opportunity as a crash course for learning on how to handle the baby. Train your husband also to how to handle the baby, especially the diaper changing and the burping part. Okay, remember, feeding is the mother's job. Burping and diaper changing is the husband's job. Okay, you can try to train him. Let's see if you're successful. Do not have excessive relative coming around. Things like relatives coming and giving you flowers and gifts and leaving Indian currency notes to the baby is one of the biggest source of infection to the baby. Okay, the currency note is for your wallet in the pocket and not for the baby. Avoid infections to the baby. More the handling, higher the risk of infection. Sometimes the baby may require a little close attention and monitoring as regards some blood counts or blood tests, especially, for example, looking for the jaundice or baby's other issues. If there is a risk of infection, we may have to do the C-reactive protein, etc. Allow the neonatologist or the pediatrician to do their job. It's an important step. There are some newborn screening tests which may be chosen to be done before the baby goes home, and that may be and metabolic screening or newborn hearing test or similar such test. Let the pediatrician take a call, and if you have any doubts, feel free to ask that question to them. Before you go home, you will also have dressing done. Your original dressing from the operation theatre will be removed, and they will be putting a new dressing, preferably a waterproof dressing, so that you can, even if there is a little exposure to water and you're cleaning yourself, it will not harm. Remember, even though the stitches are not seen from outside, there are stitches inside, and you may have a little pain there. Don't be scared about that. Also, the uterus, which was so big, is now gradually and slowly involuting and going down. So many times the patient gives us a question, doctor, I have already had a section, but my tummy is paining like crazy. I'm still having the cramps like labor pain. Well, it is Mother Nature's way to contract and retract and bring the uterus down to the original size. So don't be scared. It is a normal thing. You may also feel that when you're feeding the baby, at that time when the baby is feeding, the oxytocin released from the brain not only helps in releasing the milk, but also helps in contraction of the uterus. So if you feel that pain, don't be scared about it. It is a normal pain. It is normal. What about motions and bowel? Well, if you start having a lot of fibrous diet, you will easily pass motions. If you still don't, ask for your doctor's help and advice, and we will be able to advise you what needs to be done. Fluid intake should be absolutely important. At least 2 to 3 liters of fluid should be taken besides your other regular fluid, milk, tea, coffee and juices, etc. The reason why you need this extra fluid is you should not land up with urinary infection. Some cultures, some people insist that don't have water. Do not do that. We have had patients where because they have not taken water, they land up with bad urinary infection, and then they come back to the hospital for admission for landing up with infection in the kidneys and the urinary tract. We don't want that to be. So please have lots of water. We may have to give antibiotics for the first few days, depending on individual situations. Lastly, when you're going home, there'll be a dressing done, and the new dressing is put. All the instructions will be done. Remember, do not miss out on the 3-day, three experiences, project that we are doing in the hospital. So don't forget to pick up lovely photographs of your baby and the other things. That reminds me of the massage. So you may start having the massage whenever you feel like it's not going to harm you. Just do not let the person rub your stitches, because it's going to pain. It's not healed. It takes around a month's time to heal, maybe more, 1.5 months sometimes. So do not rub that part near the stitches, but rest of the body you can definitely enjoy yourself. There's no harm in stopping yourself from feeling nice about yourself. Once you're home, you remember that the only most important job that you're supposed to be taking care is taking care of your baby. Do not lift heavy weights. Weight equal to your baby is fair enough. Anything more than that is not something that you want to do. Sleep well. Whenever the baby is sleeping, take opportunity to take rest. The only job you need to be mastering now is motherhood. Leave all your stress behind. Do not bother about anything else. Remember, every mother is capable of handling the baby. Do not let that psychological thought creep into your brain that, oh my God, I can handle this. No, you can handle everything. You need to take care of your diet. You need to take care of your body. You don't have to exert yourself. Take your medication as advised by the doctor. You will have to come for a follow-up in the first week for check dressing or checking your stitches with everything is fine. When would you report to the hospital immediately? What are the danger signs that requires your attention to come to the hospital? 1, if you have fever more than 100. 2, if you have bloating or swelling. 3, if you have uncontrolled bleeding. Remember, a little bit amount of bleeding is normal. That's called as lochia. But if it is lots of clots, big size clots coming out, then immediately reform. A small, tiny little clot coming out is nothing, like as you get into menstruation, is nothing to be worried. But if you have large lemon size or orange size clots coming, immediately report. If you have excessive unbearable pain, you have to report. If you are not able to pass urine, you have to report immediately. If your breasts are extremely tender and heavy and they are actually causing a lot of discomfort, meaning that the milk is getting accumulated and not coming out, you need to report, and we need to tackle that. We don't want to land up with an infection and a breast abscess. It's a really tedious trouble. If you have rashes or beehive like signs coming on your skin, report immediately. So if in doubt, feel free to communicate to the hospital. Do not have doubts and always contact us. Last but not the least, remember, pregnancy and post delivery care are a continuum and a very simple process. Do not let it affect you emotionally or psychologically, and the least physically, because this is just a temporary phase and you're going to recover soon. Thank you very much.